Hi guys and girls, Matt here with Grab the Go Bag. We're doing National Registry Prep Video 2. We're going to be talking in this video about adaptive exams and how something called Bloom's Taxonomy plays into how those exams work. So Bloom's Taxonomy is a way of classifying the types of thinking required to perform a certain cognitive task. So there are 6 levels. You can think of them as bins, and a lot of people refer to this as kind of having levels of difficulty. That's not totally true. It's more like levels of how deep do you have to think to be able to answer the question appropriately. And there's 6 different bins or categories, okay? So we're going to visually look at some of those here in just a second. The first level is what people generally consider the simplest or the easiest, and that's called remembering. Recognizing and recalling facts. This is basic stuff like when you commit your multiplication tables to memory and being able to pull that information back up when someone asks you for it. That is a level 1 task. Level 2 builds on level 1, and it means that you understand what the facts mean. So not only do you have to remember the facts, but you have to understand what they actually mean. And obviously you need to be proficient at level 1 in order to be functional at level 2. Level 3, again, builds on levels 1 and 2. This is application of the facts, rules, concepts, or ideas. And again, you have to have a good solid foundation at level 1 and 2 in order to be effective at level 3. Going up further, we see level 4, which builds on everything previous. This is where you can analyze, break things down into components, and take a lot of information, kind of break down what's important in there, what do you need to know, what do you need to figure out. Okay. Level 5, again, builds on levels 1 through 4, and this is where you judge the value of information or ideas. And finally, level 6, which people would say is the most complex or the hardest level of skill, is combining parts to make a new whole. Essentially, if I give you a scenario you've never been taught to handle, can you use what you've already learned in education and experience and training to come up with a new solution that on the spot, right, that nobody has taught you previously. And we're going to look at some examples of these questions so that we can really understand the different types of questions that could be asked on an exam like the National Registry. Now, this is an adaptive exam. We'll talk about how the questions are fed to you, in what order and what difficulty and all of that in a different video, but for now we're going to just talk about examples of the different levels of questions. So level 1 again is called knowledge. Here's an example of a level 1 question. Which of these would best describe the normal respiratory characteristics for an adult patient? And you've got 4 options there, and so you really just need to know 2 things. When we're talking about normal adult respiration, we need to know the rate and we need to know the approximate tidal volume. And so by knowing that the rate is 12 to 20 and the approximate tidal volume is 500, we would then choose D as the right answer. All we had to do was be taught this information at some point, study it on flashcards or study it with whatever method we had to study it with, and just be able to recall the information later. Nobody asked us to do anything with that information. We just have to recall the correct information. So that's a really easy question. Let's move on to level 2 comprehension. Here's another example of a level 2 question. Which of these would best describe proper oxygen flow for a non-rebreather mask? So again, we have to remember the rates of oxygen flow, which hopefully we memorize somewhere along the way. And we recognize maybe a couple different categories. Maybe 1 to 6 liters per minute, such as a nasal cannula, and something like 10 to 15 for a non-rebreather. Now you'll see that answers A and C have numbers, but those numbers don't match the answers that we just came up with. So you'll have to look at B and D, and those are basically making a little bit of a judgment call now. And you have to understand what the purpose of a non-rebreather mask is. You have to understand the purpose is high flow oxygen. So is it going to be enough so the reservoir bag doesn't deflate more than half, or is it going to be enough so the reservoir bag fully deflates with a deep breath? And I would argue we never want somebody breathing off a reservoir bag to essentially empty the bag. At that point, they're not breathing oxygen from the bag, they're breathing a mixed room air oxygen composition. So the problem with that is they're no longer receiving full benefits of the non-rebreather if they ever deflate it. So this would mean the correct answer would be something like B. And again, that's a level 2. You have to understand what that non-rebreather is supposed to accomplish. Level 3, application. This is easily going to be applied to things that you physically have to do. So we're talking here about assisting with ventilations on an apneic patient. So you're using a BVM in conjunction with your partner. Your partner squeezes the bag valve mask to deliver breaths. What do? Well, this is just the procedure of using a BVM on a patient. And all we should really be able to know here, or have to know, is that ideally this is a two-person job. I know we don't always do that in the field, but ideally it's a two-person job. One to control the rate and tidal volume, the other to maintain the airway position and seal the mask. So if we're doing other things like feeling for chest rise or trying to find pneumothorax or occluding the nose, we're not able to help our partner actually do the BVM skill. So we want to choose maintain a mask seal with both hands, and that's just the performance of a skill called BVM ventilation. Level 4 analysis, we got another question here as an example. Which of these would work best to ventilate an apneic patient with a stoma? So you have to think an apneic patient is not breathing on their own, and a stoma means there's a hole from the outside of the body into the airway. So how are we going to ventilate that? Now, somewhere in your memory in that level 1, you should recall stoma being associated with a pediatric mask that would seal much better because of the small size than an adult mask. Okay? And we also know that this could either be an adult or a pediatric patient. So taking those two things together, we analyze those information parts and we say, we're going to need a pediatric mask to seal the stoma. So that means A is not a valid option, okay? B, a standard pocket mask is also not a valid option. That's implying an adult size mask. C, an adult BVM connected, an adult bag valve device connected to a pediatric mask, or perform direct mouth to stoma ventilation. Now, that's a good example, by the way, of if you've never heard it before, it's probably not the answer. So it's not going to be D. So we know that an adult bag valve device connected to pediatric mask would both give us an adult tidal volume and a good seal around the stoma. So that's going to be the right answer. All right. Moving up to level 5, this is evaluation. Now, a little side note, the original balloons in 1956, level 5 and 6 were different than they are today. It was reevaluated in 2001 and found to be more fitting if they switch levels 5 and 6. So the way we're talking about this now, level 5 is the 2001 version, the most recent version of level 5. And so now we're evaluating things to try and judge the value of different ideas or information. So you're very likely going to get kind of a long spiel question and answer on these guys. You're at a hotel evaluating a 2-year-old with difficulty breathing. This is the time of year for kids to get sick. The mom says it sounds like the child's throat is swollen. They haven't wanted to eat or drink anything today, and they've had a low-grade fever for about 3 days. So the question is, why is this type of illness in children more significant than adults? So if you just look through these answers and think about these different ideas, it should kind of pop out at you that swelling can close off the airway. If we remember things, again, like level 1, if you were ever told infant airway and neonatal airway and young child, like 2-year-old airway, it's funnel shaped and small compared to the airway of an adult or a very old pediatric, like a 13, 14-year-old child. If you remember that automatically kind of stick out at you as a key clue that they kind of gave you as far as which of these ideas matches up the best. As far as having weak immune systems or being hard to diagnose or having less medication choice, those could all be options, but it really should pop out at you that B is the closest thing to everything that we talk about when we differentiate child versus adult airway. Okay, moving on. We're going to go on to level 6. The new version, 2001 version of level 6 is called synthesis, and this means you're creating something new. So here's a classic question for synthesis. You're assessing a patient who's had both arms seriously injured during a motor vehicle crash. Which one of these locations would be the most appropriate place to auscultate the blood pressure? So what they're wanting you to think is, you've never been told maybe how to auscultate a blood pressure on a patient with no arms. But you don't have arms available here because of whatever. Maybe it's an open fracture. Maybe the vessels are severely damaged. We just can't take a blood pressure there. So if we think, I don't want to cliche the phrase, but outside the box a little bit, how could we get a good anatomic representation on the lower body? What anatomic places and landmarks could we use to mirror the upper body and the lower body? So if you think about that, the cuff would go on the bicep area, and your stethoscope bell would go in the crook of the elbow. So if we mirror that anatomy down below the belt, now we would have a BP cuff on the thigh, and we would have the stethoscope behind the knee. okay? And that would be the best approximation of lower body versus upper body anatomy. So just thinking through that, you're able to figure out a solution to this question that nobody necessarily had to teach you how to do this, but thinking through this, you're able to come up with that on your own. And that's an example of a level 6 question. Okay, so thanks for watching this. Again, this is video number 2. We're going to cover things about question series and how the questions are fed to you in video number 3. Yeah, number 3, and then we're going to go after that into some different exam scenarios and give you a couple different options there. And that's going to round out this NREMT cognitive exam series. And hopefully you're going to feel a lot better about the exam, kind of knowing what you're up against here. And we'll strategically work on ways to make you better at understanding, decoding, and kind of answering these types of questions. My name's Matt with grabthegobag.com. If this has been helpful, like, comment, subscribe. Check out our website, grabthegobag.com. You might find Google Classroom and resources, things that you haven't seen there before. We're putting new stuff up all the time. And we'll see you in the next video.